Welcome to Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are joined by Asha Strazzero-Wild, a seasoned leader with a rich and varied background in healthcare, innovation, and strategy. Currently, a principal at Outpoint, Asha specializes in providing growth strategy and execution support for healthcare innovators. Her career began with a deep commitment to service and education, holding international leadership roles at Health Leads and Citizen Schools, where she focused on program development and community outreach. This foundational experience in mission-driven work paved the way for her transition into health tech and life sciences sectors. Asha has held significant leadership positions at top firms like Precision, Value and Health, RX Review, and Advisory Board Company, where she honed her expertise in marketing, payer strategy, and helping revolutionary therapies reach the market. Today, we will explore her unique journey from the nonprofit world to the forefront of health tech strategy, her insights on overcoming industry challenges, her vision for the future of healthcare. Asha, welcome to Health Tech Heroes.
Thanks for having me today.
Glad we could talk. So your career didn't start in corporate healthcare, but in a nonprofit education sector with organizations like Citizen Schools and Health Leads. What was the driving force behind that early passion for community-based programs? And what key moment or realization inspired you to pivot your skills towards health tech and pharmaceutical industries?
When I started in college, like many individuals who go to a liberal arts school, I wanted to be pre-med. I had gone to medical camp, I'd done a lot of medical studying, and I thought that that was what I wanted to do. I even had an internship in high school with some surgeons, and I loved the idea of being a doctor and supporting people to improve their healthcare. And it just was something I always thought I wanted to do. And while I was in college, one of the things that I also did was a lot of community service. And I was the head of our community service board and got really involved in thinking about how do we improve education for youth, especially in underserved communities. And it turns out there's a really big intersection there. And the more that I got involved in youth education and started to understand what was happening, it made me really want to do more there. And so while I was in college, one of the things that I was offered was a teaching fellowship. And it gave me an opportunity to work in underprivileged and underserved schools and really think about how do we expand education access and support kind of whole learning for students who don't have a place to go from 3 to 6 in the afternoon when crime is at 3 times the rate for youth in many city areas. And I loved that work. And I was surprised that I felt like I was really fulfilling my mission of serving the communities that we work in to be better and be stronger. And so I was offered a teaching fellowship. So instead of going to medical school, I was like, I'm going to go take this teaching fellowship and work in schools. And I loved the work that I was doing and very quickly realized how important health was, kind of coming back full circle, how important health is to learning. Kids can't learn when they're healthy. I had students after school who would ask for snacks because they didn't have dinner at home. They'd been evicted. They were sleeping in their cars. They had asthma and they were living in housing that had mold and it was slum level conditions. And it very quickly kind of came back to me how important health is to being in a space where you can learn and be a productive member of your community. And so it really propelled me back into the health space. And I started work with a public health company, and they were really thinking about how do we serve our communities through pediatric clinics. And they worked really closely with physicians and pediatric offices to work with families around social determinants of health. So families were coming in and saying things like, I need help with mold remediation. I need help with housing. And I worked with a cadre of college volunteers who were kind of imparted to do this work with families. So many of them are pre-med. I really related to them. And I had this opportunity to really understand teaching and learning through my fellowship experience to be able to apply that to the work that I was doing in hospitals. And I worked with 26 clinics around the country, really thinking about how do we improve the work that we're doing in the pediatric space to create healthier families and healthier communities. And it was really frustrating. I was in hospitals all day working with physicians in the EMR and looking at the ways that we were gathering data, looking at how we were trying to track outcomes for patients and families. I very quickly realized how frustrating hospital and healthcare work was. Again, coming back into the medical space. And one of the medical directors that I worked with said to me, you should really check out the advisory board. They're doing incredible work around healthcare. If you really care about health outcomes and how do you truly create healthy families, it's a place that you should check out. So I had this opportunity to go to the advisory board and really get steeped in the work that hospitals were doing. And I loved in particular the work that I was doing around the patient experience. So I did sales, I did marketing, I did product marketing. And the thing that I loved the most was the work that I was doing there around the patient financial experience in particular. If you can't afford your medications, you're not going to get healthy. So when a doctor comes in and says, your child has an ear infection and needs erythromycin, and a patient is given the cost of their medication and they can't afford it,
It's
it doesn't
okay.
actually really matter if you don't have coverage, if you from your insurance, if you don't have money to pay for it. And so I really loved that work that I was doing there. And that was really kind of how I came into the healthcare space to really think much more holistically about how are we working with hospital and healthcare systems to improve the patient experience in healthcare.
There is like so many things I heard. First thing which struck me was actually a little bit striking in a way that you don't have to do too much magic. I'm sure you're doing, but just keeping away from 3 to 6 time where high crime is there and keeping away from the mold for a few hours a day. Even that itself is like so much value, right? Just keeping them away from something and stuff like giving something amazing or education, just keeping them away from that environment itself is a huge factor, like keeping away from crime. Like, how awesome is
Yeah.
that? And the second thing was just the width of experience that you have had. You had like on the field and in the clinic and in the marketing, just about everything is pretty fascinating. That kind of leads me to the next question as well. But before that, the fact that he cannot afford erythromycin is pretty sad. It should not be that expensive at this point. Yeah, it should be business. But anyway, pivoting from hands-on program director to high-level marketing and growth strategies requires a significant shift in perspective. What was the biggest personal challenge you had to overcome in making the transition? What new skills did you find you had to learn very quickly?
It's a great question because I think everyone thinks you can just go get into strategy work and I can be a strategist. And the truth is, you need a lot of experience. And I don't think I could be doing what I did today, kind of to your point, without the experience that I had. And part of that experience comes through the hands on piece, but part of it just comes from perspective, reading about what's happening in the news, understand what's happening in the industry, looking at policies, looking at regulations. And I think in order to be really effective, true strategy is being able to look forward 1 year, 3 years, 5 years, and being able to see what's coming. And experience gives you that, but you also have to be reading and talking to people all the time. And so I really had to make a transition in my own thinking of like, it's not just doing, but it's setting aside the thinking time and it's setting aside the time to read what's happening and to talk to people who you know are industry experts and make time to network with them and learn from them and read what they're writing about in order to actually be able to do your work effectively. And I think that was a shift for me. I was so used to just doing the work, like sit down and get it done. And sometimes you actually have to stop doing stuff and make the time to sit and think. My business partner, Kelly Wilder, and I talk about plan to plan. You've got to sit back and make the time to plan and block time in your calendar every day to be understanding where the industry is headed.
That is like one of the most fascinating advices too, because generally you come with the idea of action, right? You have to take action too. And this is also like, you need to take action, but also set time for thinking. So you got to do both.
Yeah.
Action is like very important, but I think if you're a strategist, specifically if you're a strategist, thinking is one of the most important things. So let me ask you this. I want to go back a little bit further in your time, in your life, before college, in fact. And then for a reason, you got into this social work, right? You got into like thinking about helping people. Why? Because as a graduate student, you're not thinking about like, how can I go help kids who are underprivileged? You're thinking about so many other things. What happened? Like, why did you even step into that direction, in a general direction?
Everyone has had someone in their life who's had some type of a medical procedure or had some time in their life when they weren't feeling well. And I think it's a time when you're really vulnerable. And I think everyone, hopefully, can relate to what that means, whether you're a caretaker or whether you're the person who's sick. And I think it's really easy to get caught up in the everyday of, I want to help people, and that's great, but to what end and for what purpose? And I think my whole life, I've been in a very privileged and lucky position to be able to have food, to have a roof over my head, and to feel really confident that I was set up to learn and be a positive contributor to society. And I was definitely raised in a house where I was taught to look around and learn and see the privilege that I had and understand that there are barriers to that for individuals. And that is our collective and community responsibility to be kind and to every day try to make the world a little bit of a better place. And so I really grew up with that mentality, which I think is really why I initially was like, I'm going to go be a doctor. They help people who are sick. And it's kind of eye opening to me to learn that there are so many other ways. And it seems so obvious now when I look back, But there's so many ways that you can be an active member of your community and help in ways that impact health that aren't just being a doctor.
So you are now a principal at Outpoint, which focuses on providing growth strategies for healthcare innovators. So what is the most common roadblock you see brilliant health tech companies hit when they try to scale?
I think everyone wants to just get stuff done. People are
Yes.
excited, they're passionate. Most of the innovators that we're working with and the CEOs, they haven't gotten there by mistake. They've gotten there through grit, through hard work, through determination. They've got a really good idea and they are going to plow straight through the boulders in front of them. They're going to figure out how to pick a lock on a locked door. And I think now many of them are at the stage, and this is what Outpoint does, is work with folks who are ready to say, I want to scale. Like, I don't want to walk through one picked locked door. I don't want to plow through one boulder. I need to build a house that's sustainable. And I think we talk a lot about building a strong foundation for your house, building a house that's intentional, that can weather the environments that are going to change, policies change, regulations change. We've got to build something really strong that can weather those storms and also build something that has doors and windows to the right places. Like, what do you need to be able to see that's coming? What do you need to be able to open doors to so that you can expand and build your services and your platforms? And I think for us, one of the things that's really important is thinking about building those systems and infrastructure that enable you to scale. And there's a lot of like, let's build it fast. And I think not enough of let's think strategically about where we want to be in 1 year, 3 year, 5 years, or maybe we don't know. And therefore, you need to build something that's going to be flexible and nimble and build systems that are replicable. And I think for us, one of the things that we love doing is saying we have experience, we have expertise in areas that are going to help you set up those systems to be scalable and be sustainable. You're going to need to create content all year. You're going to be wanting to go to conferences multiple times a year. You can't put all of your effort into doing one thing well and then have to recreate your materials every single time. And so part of what we're doing is working with companies to really think about how do we help you understand the impact of the decisions that you're making financially, you're making from a strategic marketing perspective, that you're making from an integrated sales perspective. How do you really think about all of those from a long-term perspective and build something that can grow with you and evolve with you as the market changes?
So Outpoint emphasizes the critical importance of sales teams and workforce integration in an increasingly digital world. Why is the human element still so vital for success? And how do you help companies build that bridge between the technology and people who use it?
It's really interesting that AI is so popular right now. I think AI absolutely has its place. I think technology has its place. And there's always going to be a human element. People are people. They bring their experiences, they bring their expertise, they bring their IQ and their EQ. And you still have to interact with people to get the work done. So I think what's really important is that work feels integrated, that it feels comprehensive, that you have a set of shared goals to work together against, and that you have a shared strategy and a shared set of tactics to implement that work. And I think for us, one of the things that we're really focused on is where does human impact really matter and where can things be automated in systems so that you can really optimize your dollars and optimize people's time.
That's awesome. Just going into this, is there a high level division that you say that, hey, this should be always human and this should be integrated, right? When as a strategist, you probably want to have a look at like 50,000 feet, then get into 30,000 feet, then get into the 10,000 feet. From the 50,000 feet, like the high altitude look, is there a rough division where you think that the human intervention is like non-negotiable and integration is makes the most sense? Are there any divisions from your perspective?
Yeah, it's hard to say because it depends on the technology and the tools. But I think part of what I think, is the message that we always give is at Outpoint is you've got to take the time to sit and assess and take the time to plan and take the time to think through it. And I think one of the things that we talk a lot about is ready, aim, fire. Like you can't just start shooting off a whole bunch of
Sure.
ideas and
Yeah.
action plans. Like take time to sit, to plan, get ready, get your teams aligned, and then aim and fire. And so I think that's one of the things where this kind of human piece comes in take the time to get set up so that people are aligned in the work that you're doing across the board.
Certainly. So basically, I'll come to the strategy part a little bit because I think I want to get your input very specifically on strategy and technology later on. But could you share a recent win from your work at Earthpoint, a case where your team's strategic guidance helped a health tech innovator overcome a major hurdle and achieve a significant breakthrough? A topic basically you talk about with your family. This is what we did, something you're like super proud of.
There are a couple things that I would say that we've touched on today that I think kind of lend themselves well to dig a little bit deeper on here. One is, what are some of the challenges? Time and budget. So that's one of the things that we talk a lot about with the companies that we're working with. Like, you don't have a lot of time, you don't have a lot of budget. How do you optimize what you have, and how do you make sure you're getting the impact that you want? So what's the impact that you're looking for? You're looking for leads? Are you looking to do whatever in the market and get your market message out there? Is it a combination of both to new customers? Are you trying to retain customers? And I think for us, again, one of the things is like, what are you trying to do? And then what are the right strategies? And then what are the right tactics? So when we start to hear companies talk about budget, time, market awareness, new customers, retaining current customers, one of the things we talk a lot about is like, what's a win that you can kind of get all of those? And I'll tell you, one of the companies that we're working with is thinking about all of these things, and a very specific, you're asking for like a specific story. One of the things we talk a lot about is, what are the activities that you're going to do out in the market to see the impact that you're looking for? And I think there are some very specific activities that we talk about with many of these clients, like think about partnering with a company to host a webinar. There are a lot of great partner companies out there where you can partner with someone to extend your reach. You can leverage partners to be content developers with you. Once you have that webinar, you can take that content and create a white paper. You can create video clips. You can create blog posts. You can have all sorts of content that comes out from something like a webinar, and you've optimized 4 or 5 different opportunities with that small amount of budget to create a set of assets, to create materials for your sales team, to reinforce your message in various channels, to extend your reach by leveraging partner contacts. So I think, again, this is a really specific example that you're asking for around what are challenges that you see and what are specific ways that a company can address some of those in a very specific and tactical way. But I think people are looking for ways like, how do I actually do that? And then what does it mean to operationalize that? And that's where we love partnering with companies to actually help them.
So there were 2 levers that you spoke about. You spoke about budget and time. There is a third lever also as consultants we think about is the quality.
Yeah.
Hey, we have like 3 aspects. You choose 2 of this. So if you want quickest and you don't have high budget, then you have to compromise on the quality. If you want highest quality and have good budget, right, then we can give it like, really fast, right? Whatever it is, like you have to give 3, pick 2, and that works, right? If you can pick only 2. But anyway, why did you say very specifically time and budget? My thought would be like in healthcare, you don't want to compromise on quality at all. The outcomes are most important. Is there where thought is?
To me, quality is a given, and you're
Okay.
not going to engage in any activities that are not high quality.
Okay.
And I think there's certainly something to be said for specifically naming that. And I think for me, what I've learned is that everyone just expects high quality, and you need to figure out, what does that look like for you? And one of the things that we talk a lot about is what we bring to the table is expertise and experience. And again, I think there's a lot of reading that you can do out there. There's a lot of courses you can take and get certified. But when the rubber hits the road, experience is actually part of a huge piece that drives quality. And so for us, I think one of the pieces that we bring to the table is we've done the work that many of our clients are asking us to do, and asking us to understand, like, what are the KPIs that we're looking for? How do we measure those KPIs? And that's what I'm talking about, creating those sustainable systems. You don't want to be recreating a dashboard for every webinar. You don't want to be looking at conferences and every single time trying to set meeting targets and measure the outcomes and see your close rates. Like, you've got to have systems set up that are going to do that in a human touch but automated way, so that you can optimize your time and your budget to focus on being in those meetings and being present with those individuals. And so I think for us, the quality is an expectation, and the levers that you pull to use that experience and the quality in different ways, that's where you start to look at the budget and the time. How much time do I have to spend on this before I need to see results? and what's the budget and how do I allocate it to these various activities?
Makes sense. It's like overall advice. And I say this like have good budget
Mhm.
or have good time. You
Yeah.
don't want to pull the other lever at all. Very well aligned with the thought process. Thank you very much for that. Yeah. With a background in both program development and marketing, what is the single most important piece of advice would you give a new entrepreneur trying to launch a product in the crowded health tech market? I think you did give me a quality advice, but beyond that, if there is something else.
I think one of the things, in addition to kind of that measured approach, is find other trusted partners. One of the things that Kelly and I are doing regularly are attending events, not conferences and big events, but like smaller networking groups, setting up one on one calls to just pulse check what other people are hearing and feeling in the industry. And I think that's really important. There's no business objective, there's no quid pro quo. It's an opportunity to be part of an individual small group and sometimes larger group learning community to really be positioning yourself around understanding what's happening in the market and just kind of hearing what's happening for organizations that you're working with outside of the immediate people that you're working with. And I think that's some of the advice that I would give is setting up that network for yourself and continuing to grow that network and identify different organizations and people who can serve as sounding boards for you when you're thinking through things. The market's evolving really quickly. Technology is evolving quickly. Policies are changing. And so I think it's really important that as you're thinking through things, they always say multiple heads are better than one. I truly believe that when you have a lot of perspectives, the more data you have, the more data driven decisions you can make, the more likely you are to be directionally, if not fully correct, in the advice that you're making for yourself and for your clients.
Also, since you have worked in multiple facets of healthcare, from providing facing technology to pharmaceutical value communication, what are the greatest opportunity for innovation right now? Fundamentally improve patient experience. This is like basically if you have to say something that, hey, this is like, it's almost a technical advice, right? Say, this is where you need to concentrate on, right? It is the clinic on the bedside, or it is like right before the clinic when the patients come in. And this is like very specific advice. What do you think is the biggest gap right now?
It's funny, we work with a lot of organizations who talk about the patient centered experience. And as someone who's really focused on patient outcomes and that patient experience, that means a lot to me and makes a lot of sense. At the end of the day, a lot of the organizations we're working with aren't directly serving patients. They are sometimes serving health systems, they're serving payers, they're serving other entities that down the road ultimately impact the patient experience, but they are not necessarily that first line impact on the patient experience. And so I do think part of what I think is really valuable is how do you continue to get patient feedback so that you can work upstream from that in a way that does ultimately impact the patient experience and doesn't make those assumptions about what's happening between your organization and that middle entity and the patient.
Yeah, going back to your previous, more data, better decisions that you make. And just making sure that you get enough data from the patient itself is probably very critical for patient experience. Thank you very much for sharing, bringing that out. If you could go back and give your younger self an advice, right? You're just starting out at citizen schools. What would be that piece of advice for the journey ahead? And this is for like these young people who are aspiring to be in the healthcare. This is for people who are like, college students, or perhaps right after college, they had a small career and they are planning on switching and thinking about doing something different and meaningful like you have done. What would be that?
I would say the advice that I would give is there are so many ways to impact things that you care about. And when I was younger, I was kind of locked into this idea of you need to be a doctor in order to impact health outcomes. There are so many careers and there are so many companies and ways that you can do that. And so taking the time to learn about all of the things that are impacting ways that and things that you care about is really important, but it's just as important to understand and think about what are all of the other things that you can do to be involved in. And I think some of them present themselves as really obvious answers and some of them don't. And there are things that I've learned that I look back and I'm like, wow, that individual really is impacting the system. And if you go to work every day and just think like, hey, I'm processing, financial paperwork, that's one thing. But at the end of the day, that financial paperwork might be about processing paperwork that's going to get a write-off for a patient that they need because they need financial assistance and it's going to allow them to pay for their child's medication. it's hard to kind of put that all in perspective when you're just kind of focused on like, I'm going to get a job and I'm going to impact patients. But there are just so many ways that you can do that. So figuring out like what's your passion and then thinking about how does every day your work relate to that passion is what I would say to folks. I didn't expect to kind of come back to healthcare in the way that I did. And I think opening doors that are in front of you and seeing where your passion takes you and realizing there's a lot of ways to get to the outcomes you want it's a journey. And I think if you allow it to be a journey, you'll land where you're supposed to land.
Before we wrap up, Asha, you will have 90 seconds to share everything that we missed or anything we missed or reiterate anything that you deem very important.
What I would say is like be flexible, both in the way that you approach your career around kind of finding where you want to have impact, but be flexible as you're doing it. I've had a very, what I would call circuitous journey to where I am now, and I'm sure it's not over yet. I don't know what I'll do next. But what I would say is I think it's really important to take every piece of experience that you have and to learn from other people's experiences and to fold that in. There are so many experiences out there that are valuable that you may have an opportunity to share with someone or that you may not. So learning about it is equally important. And I think it's really important to position yourself as a learner. I think for me, that's the biggest advice and the thing that I would end on is how do you position yourself as a learner every single day? Because technology is changing, people are changing, needs are changing, policies are changing. And I think there are so many things that you need to be able to keep up with. So listening to experience and being nimble and flexible in the work that you're doing will allow you to keep having impact.
Asha, it was incredible talking to you. And there was like so many learnings that I have to go back and learn from everything that I have said, because I think every answer to the question was masterclass in itself. I think we can spend an hour on each one of them. But with that, I would really, really thank you.
Thank you so much for having me.